We're going to take a look at Unit 13 in your textbook today, and Unit 13 deals with diabetes. Now, diabetes is actually a chronic disease that's characterized by the abnormal utilization of carbohydrate by the body, and it results in elevated blood sugar levels or blood glucose levels. Now, diabetes actually comes in three different forms. You have type 1, type 2, and then also gestational diabetes. Type 1 is actually having the high blood sugar levels resulting from the destruction of the insulin-producing cells on the pancreas. Okay, so the pancreas, the beta cells in the pancreas actually are destroyed, and now the pancreas is no longer able to produce the insulin, and therefore those individuals have to take an insulin shot on a daily basis to regulate their blood sugar levels. On the other hand, type 2 diabetes is the pancreas is still producing insulin, but what happens is the body is becoming resistant to the insulin, and so now it's maybe taking more insulin being produced to allow the flow of glucose out of the bloodstream and into our cells to produce the ATP. So we have that insulin resistance over time. So the pancreas has to work harder to produce that insulin to release the glucose from the bloodstream into the cells. Now, as far as what is the more common form, 90% of all cases are actually going to be considered type 2 diabetes. So that's the more common form of diabetes. Gestational diabetes, on the other hand, is developed during pregnancy. So many women suffer gestational diabetes as well. So as far as the numbers go, the diagnosis of type 1 and type 2 diabetes is having a fasting plasma glucose level of 126 milligrams per deciliter or higher. Okay, so that's a diagnosis of having diabetes. So again, when we look at type 1 versus type 2, it shows us here just that yes, there's an insulin deficiency. So type 1, the pancreas is not producing insulin, but in type 2, it does produce insulin, but in the later stages of the disease, the pancreas could eventually stop producing insulin because it's being overworked. The number of cases of type 1 are relatively low, so only 5 to 10%, but more like 90 to 95% of those cases are actually going to be type 2 diabetic. Some of the risk factors for type 1, it's really a genetic predisposition. You know, if it runs in your family, there's a higher chance you're going to get it. And then also it's an autoimmune disease where the body attacks itself. So something is attacking the beta cells on the pancreas that destroys those cells, so the pancreas can no longer produce insulin. Type 2 diabetes, on the other hand, the most frequently cited risk factor for type 2 diabetes is a sedentary lifestyle. So sitting, being overweight, especially the abdominal or visceral obesity, are huge risk factors as well. How do we treat type 1 diabetes? Insulin, right? They have to take those insulin injections every single day to regulate it, but then there's a dietary pattern that they must follow, and they need to exercise with it. Type 2 diabetics, on the other hand, in almost every case, weight loss is recommended. They need to lose anywhere from 7 to 10% of their body weight immediately to help reduce the risks of that disorder. Having high blood sugar levels, there are many signs and symptoms to look out for. So the first one is an increased thirst. We're constantly thirsty, so we're drinking a lot, and therefore we're urinating a lot as a result. In addition to that, headaches that just don't seem to go away, difficulty concentrating and focusing on things, our vision might be blurred, just a general tiredness, and then maybe some unexplained weight loss. Those are all signs that our blood sugar levels might be elevated, so we definitely should get checked. Other health consequences of diabetes, the short term, like I just said, the blurred vision, the frequent urination, unexplained weight loss, even wound healing that's taking a long time to occur, being very hungry or very thirsty. Long-term consequences of diabetes definitely leads to heart disease, okay? And then also high blood pressure, damage to those nerves, okay? Blindness is another key condition that diabetics suffer from. They have kidney failure sometimes in the end stages of the disease, and even stroke and amputation of those limbs is common long-term consequence of diabetics. So the number one cause of death in those people who have diabetes is heart disease. Okay, so People with diabetes for long periods of time tend to develop heart disease, and that's the cause of death normally. Prediabetes we define as having a blood glucose, fasting plasma glucose level of 100 to 125. Now remember, 126 is diagnosed as diabetes, either type 1 or type 2. So getting your blood sugars checked regularly is very, very important. So risk factors for diabetes: having a high level of visceral fat storage, being inactive, and even having a family history is very, very important. So here are those numbers again. So fasting blood glucose levels of less than 100 are normal. That's what we want to be. Anywhere from 70 to 100 is a good fasting glucose level. Prediabetes, on the other hand, is where 100 to the 125, and then diabetes is being diagnosed as 126 or greater. Sometimes people do a 2-hour post-glucose measurement. So they might load and drink, this sugary drink that tastes terrible, and sit for 2 hours and then get their blood sugar tested. And then if that's the case, these are the healthy numbers. These would be the pre-diabetes, and these would be the diabetes. And then the other big one for diabetics is checking their hemoglobin A1C. And that actually is the measure of the percentage of hemoglobin proteins in our red blood cells that are attached to this glucose. So what it's doing is it's representing our blood sugar levels over a several month period. So a healthy A1C is anywhere between 4 and 6%. Prediabetes you can see here, and then diabetes would be anything greater than 6.5%. So knowing those numbers, getting your blood sugars checked on a regular basis is very important in the prevention of diabetes. So if we find out we're in the pre-diabetic state, making simple dietary changes and adapting a regular exercise program can definitely regulate those blood sugar levels and hopefully get them down to the normal. Metabolic syndrome, I talked a little bit about in the previous chapters, is having a bunch of different metabolic abnormalities, one of which being a waist circumference that's equal to or greater than 40 for males or 35 for females. Blood pressure, having a 130 is a systolic and over 85 diastolic, so anything at or above that. Triglycerides at or above 150. HDLs, which are your good cholesterol, if they're less than 40 for men and less than 50 for women, that's not good. And then if your fasting plasma glucose is anywhere greater than 110, okay? If we have any 3 or more of these 5 metabolic abnormalities, we would be diagnosed as having metabolic syndrome. So the way I think of metabolic syndrome is if we're diagnosed with that, that just simply means that we are on a fast track to developing cardiovascular disease, maybe diabetes, type 2, or even some form of cancer. So paying attention to these numbers, knowing what they are, and trying to keep them within the recommended ranges so we do not develop metabolic syndrome. And remember, people who are overweight or obese generally have a myriad of these metabolic abnormalities going on in addition to being overweight. So how do we manage type 2 diabetes? Weight loss is key. Like I said, anywhere from 5 or 7 to 10% of their body weight is key in reducing the risk of the disease, but also many people, lose the weight, they adopt a healthier dietary pattern, and then they get their blood sugar levels tested and they don't have diabetes anymore. So that is definitely a plus on that side. Need to adopt at least 150 minutes a week of regular physical activity. As far as dietary management, obviously just a heart-healthy diet is so important. So having 5 to 9 servings a day of fruits and vegetables, choosing whole grain and high fiber types of carbohydrates is key. In addition to that, a lot of beans, nuts and seeds are great too. And then fish and shellfish are important as well. Diabetes or diabetics, it's important for them to pay attention to the glycemic index. And the glycemic index is a measure of the extent to which your blood sugar levels are raised by a consumption of an amount of food that contains 50 grams of carbs compared to 50 grams of glucose. So the glycemic index is a scale from 0 to 100. And the foods that are between 70 and 100 on the glycemic index are considered high glycemic index foods. So basically we're saying that these types of foods are going to elevate your blood sugar levels very rapidly. Low glycemic index foods are foods that are less than 55 on the glycemic index scale. So these types of foods are going to slowly release glucose into your bloodstream, but not at the rate or as much as these foods in this first column. Okay, and then of course the moderate or medium glycemic index foods are the 50s and the 60s. Obviously, diabetics want to choose foods that are in the low glycemic index column, okay, because remember, diabetes is characterized by it's the abnormal utilization of carbohydrate that results in elevated blood glucose levels. So these people already have problems transporting that glucose out of the bloodstream. So therefore, they want to choose foods that are lower on the glycemic index. So this glycemic index is very important for diabetics. Also, an interesting study in the prevention of type 2 diabetes, they did it in 3 years, over a 3-year period. They took people who were pre-diabetic. Now remember, pre-diabetic was having a blood glucose level of 100 to 125. So they took those pre-diabetic individuals, and those people reduced their risk of moving into type 2 diabetes by simply doing 2 things. They lost 7% roughly of their body weight, and they started to exercise 150 minutes per week. Other things they tried to do is they did more whole grains and high fiber types of foods. They drank maybe 1 to 4 cups of coffee a day, moderate alcohol intake, no more than 1 or 2 drinks a day, and they made sure they got adequate amounts of vitamin D. And by doing that, they reduce their risk of moving forward from prediabetes to diabetes. So simple lifestyle changes can hugely reduce our risk. Type 1 diabetes, I already talked about. It's an autoimmune disease. Pancreas is not producing insulin. Okay, so therefore, those individuals usually have to take an insulin dose, periodically throughout the day to regulate their blood sugar ranges. So they have to definitely carefully plan their meals, and they have to be specific times throughout the day, and they're constantly checking their blood sugar levels to make sure that they are within those normal ranges. So this is just an example of an insulin pump. There's some great technology out today that folks can, live with type 1 diabetes for a long time and not have any issues with it. Gestational diabetes, it's not as common, but women do develop it. Our risk of developing it actually depends on our age. So the older we are going into pregnancy, we have an increased risk. The more overweight we are going into pregnancy, our risk is increased. And then ethnicity. We tend to see it more often in Hispanic and African American women as well. And note that babies who are born to women who have poorly controlled diabetes are definitely themselves at a greater risk of developing diabetes later in life. So usually when we have the baby, the diabetes gestational does disappear, but for that woman as well, her risk of having type 2 diabetes later on in life also is going to increase as well. And then on the flip side, we have low blood sugar. So that's hypoglycemia, low blood sugar levels, and that's anything less than 70 milligrams per deciliter. So symptoms of low blood sugar levels, and many of us probably have suffered this at some point in our lives, or even during the day when we haven't eaten for a long period of time. We're irritable, right? We call it hangry, or we're nervous, or we're sweating, or we're extremely hungry. Those are all signs that our blood sugar levels are relatively low. So we need to ingest a rapidly absorbing carbohydrate. So maybe it's fruit juice, something that's going to absorb quickly into the bloodstream to elevate our blood sugar levels. And this is especially important for diabetics, right? We want to really try to eliminate dropping too low for our blood sugar levels. So that's why they're checking their blood sugar or their glucose periodically throughout the day. So you can see in the year 2000, red, the amount of cases of diabetes, and the projection for the year 2030, all around the country, it's just increasing. So it's definitely a disease that is on the rise. and it's not going anywhere. But if we look back at those risk factors and prevention, there's a lot of things we can do to prevent type 2 diabetes. And remember, 90% of all cases of diabetics are going to be type 2. So prevention is key.